The United Nations Secretary General has urged governments to invest more in the health system as he launched COVID-19 and universal health convergence policy. According to the UN chief, the world was never prepared for the global pandemic. Detail in this report by our Amadou Kante.
The UN Secretary General Antonio Guterres has said that the world was not prepared for the COVID-19 pandemic, which for the past 9 months has infected more than 30 million people in 119 countries and territories, and infections are still rising. The United Nations chief was speaking on Wednesday at the launch of the COVID-19 and universal health coverage policy. He noted that one of the lessons from the crisis is that underinvestment in health can have a devastating impact on society and economies.
COVID-19 has shown that universal health coverage, strong public health systems, and emergency preparedness are essential to communities, to economies, to everyone. That is the backdrop to the policy brief we are launching today. At least half the world's people do not have access to the health services they need. Some 100 million people are driven into poverty each year by catastrophic healthcare costs.
Universal health coverage is defined as a situation where all individuals and communities receive the health services they need without undue financial hardship. Mr. Guterres also said the pandemic has severely ravaged the world economy, leading to millions losing their jobs.
The pandemic is costing the global economy $335 billion a month. Some 500 million jobs have been lost so far. Human development is going into reverse for the first time since we start measuring it in 1990.
As the world envisages a lasting solution for the pandemic, the UN boss highlighted major recommendations in a brief policy that includes protecting delivery of other health services during the pandemic.
COVID-19 is indirectly killing people with heart disease and cancer as well as those it infects. And access to mental health services and sexual and reproductive health programs cannot be compromised. Fourth, we need to ensure everyone, everywhere, has access to future COVID-19 vaccines, tests and treatment.
At least half of the world's population still do not have full coverage of essential health services. Over 800 million people spend at least 10% of their household budgets to pay for health, according to the World Health Organization. Reporting for Africa News, I am Amadou Kante.
UN Secretary General Antonio Guterres, they are urging governments to invest more in the health system as he launched the COVID-19 and universal health coverage policy.